country, people often go around saying that we have the best care, but really, while we do have some good, excellent centers of health care, they're only available to those who can afford them. We find that rich people come from abroad to this country to get health care, while our people are struggling and find themselves going to places like Mexico to get surgery, or to Canada, or people that I know who have left the country, gotten sick, and now they can't return because they won't be able to get health care now that they have a pre-existing condition. They're cared for abroad, but they can't come home to their families. What sets us apart from the other industrialized nations is that we use a market-based model of paying for health care, that we don't see health care as a human right, the principles of human rights being universality, equity, and accountability, and we don't have a system of what our population needs. The reality is that health care is a huge drag on our economy. Our healthcare costs are rising 2.5% faster than our GDP each year, so it's not a sustainable course that we're on. If we actually brought our healthcare costs in line with what other countries are spending, we would have a budget surplus right now. So Medicare and Medicaid are not the causes of our deficit or our healthcare cost crisis. They're actually the victims of our healthcare cost crisis. And so we see this solution as a national improved Medicare for all, our national single payer, creating a national universal system, publicly funded so that it's accountable, with a progressive taxation so that it's fair, so that it's lifelong, it's comprehensive, no copays or deductibles, so that when you're sick and you need to go get care, you're not facing any barriers to getting that care. You're not worried about, well, my rent's due this month, so I can't really pay that copay or that deductible for that medication or that test or that visit. It's about creating a system, a rational, publicly accountable, publicly funded system. At a time in our country when we see such suffering and death and really had a need for an open and honest debate about what we required for health in this nation, we saw instead a very strictly controlled, scripted debate that was heavily influenced by the insurance corporations, spending $1.4 million a day on lobbyists in Washington, D.C. The legislation in the Senate Finance Committee was overseen by a former Vice President of Public Policy of WellPoint, one of the largest insurers in this country. She has now been transferred by the White House to the Department of Health and Human Services to oversee how this legislation is regulated. So it couldn't be any more blatant. And this is what we're up against. How are we going to change that? We must create a movement that is independent of political party. It's imperative that we understand what it is that we require in this country and that we're very clear about what that is. And we need to be uncompromising in our demands. Too often in this nation, we're willing to accept small change, and that's what we've been doing now for decades. And none of those small changes, as we try to patch together the healthcare in this country, none of those changes have moved us forward. Too often in this country, we've been divided. We have this whole right-left raging at each other, and the mainstream media feeds that division, and that's used to weaken us as a people. If you actually talk to people across the board of what their political belief is, we share so many common beliefs. People do believe that if someone in their family gets sick, that they should get health care. Martin Luther King said that to witness an injustice and to ignore it, to do nothing about it, is committing an act of violence in itself. And so it's imperative that we continue to do this work as the seriousness of the situation compels us to do what we can to make these changes.